Musculoskeletal system analysis. The musculoskeletal system is the body's framework and movement system. It consists of bones, skeleton, provide structure and protection. Joints, connect bones and allow movement. Muscles, generate force and movement. Cartilage, cushions joints. Ligaments, connect bone to bone. Tendons, connect muscle to bone. 1. Overview of the human musculoskeletal system. Primary functions. Supports body weight. Enables movement. Protects vital organs. Produces blood cells. Bone marrow. Stores minerals such as calcium and phosphorus. 2. Major components of the skeletal system. Skull. Key functions. Protects the brain. Supports facial structures. Houses sensory organs, eyes, ears, nose. Important notes. Skull fractures can be serious due to brain involvement. Head injuries should always be evaluated carefully. Spine, vertebral column, structure, 7 cervical vertebrae, neck, 12 thoracic vertebrae, upper back, 5 lumbar vertebrae, lower back. Sacrum, coccyx. Common problems: herniated discs, degenerative disc disease, scoliosis, chronic lower back pain. Warning signs: persistent back pain, numbness or tingling in limbs, loss of strength, pain radiating down the leg, sciatica. Shoulder joint. Characteristics: most mobile joint in the body allows a wide range of motion. Common injuries: rotator cuff tears, shoulder impingement. Dislocations. Important point. Greater mobility means less stability, making the shoulder vulnerable to injury. Knee joint. Components: femur, thigh bone, tibia, shin bone, patella, kneecap, menisci, cartilage pads, cruciate ligaments. Common conditions: osteoarthritis, ACL tears, meniscus injuries, patellofemoral pain syndrome. Important point. The knee bears significant body weight and is one of the most commonly injured joints. Hip joint. Functions: transfers body weight during standing and walking, provides stability and mobility. Common disorders: hip osteoarthritis, hip fractures, avascular necrosis. Important point. Hip fractures in older adults can significantly affect mobility and independence. 3. Types of joints. Joint type. Example: movement, ball and socket. Hip. Shoulder, multidirectional. Hinge, knee. Elbow, flexion, extension. Pivot. Neck, zjednotsedva. Rotation, gliding. Wrist, ankle. Sliding motions, fixed. Skull sutures. No movement. 4. Common bone and joint diseases. Osteoarthritis. What happens? Cartilage gradually wears away, causing pain, stiffness, reduced mobility. Risk factors: aging, obesity, previous injuries, repetitive joint stress, osteoporosis. What happens? Bones lose density and become fragile. Major risks: hip fractures, vertebral fractures, wrist fractures. High risk groups: postmenopausal women, older adults, individuals with low calcium intake. Rheumatoid arthritis. Characteristics: autoimmune disease, joint inflammation, symmetrical joint involvement. Symptoms: morning stiffness, swollen joints, fatigue, herniated disc. Symptoms: back pain, neck pain, numbness. Sciatica. Causes: heavy lifting, poor posture, age-related degeneration. 5. Key warning signs. Not to ignore. Seek medical evaluation if you experience persistent joint pain lasting more than 2-4 weeks, joint swelling, redness, or warmth, sudden loss of joint function, unexplained fractures, progressive loss of height, persistent numbness or weakness, severe back pain with bowel or bladder changes. 6. Essential bone and joint health tips. Nutrition. Focus on calcium-rich foods, vitamin D sources, adequate protein intake, omega-3 fatty acids. Good choices include dairy products, sardines, salmon, eggs, leafy green vegetables, nuts and seeds. Exercise. Best activities for joint health: walking, swimming, cycling, resistance training, yoga. Aim for 150 minutes of moderate exercise per week. Strength training 2-3 times weekly. Maintain healthy weight. Excess body weight significantly increases stress on knees, hips, lower back. Even a 5–10% reduction in body weight can reduce joint pain. Posture and ergonomics. Maintain neutral spine alignment, proper desk height, screen at eye level. Regular movement breaks every 45–60 minutes. 7. Lifelong bone and joint protection checklist. Daily. Walk or exercise. Eat protein-rich meals. Get adequate calcium. Stay hydrated. Weekly. Strength training, flexibility and mobility exercises. Long-term. Bone density screening after age 50 earlier, if at risk. Regular physical activity. Avoid smoking. Limit excessive alcohol consumption. Summary. The most critical structures to protect are spine, central support and nerve protection. Knees, highest load-bearing joint. Hips, essential for mobility and balance. Shoulders, most mobile and injury-prone joint. Bone density, crucial for preventing fractures later in life. Strong bones require calcium plus vitamin D plus resistance exercise, while healthy joints depend on movement, muscle strength, flexibility, and maintaining a healthy weight.